Alright, I'm going to provide privacy, do my hand hygiene. Hi, I'm Savannah. I'm going to be your student nurse. I'm doing a full head-to-toe assessment on you today. Can you tell me your name and date of birth?
Audrey Pulley, 7/14/05.
Okay. I'm going to start by looking at your facial features. I see that they are symmetrical, and looking at your nose, it's midline and even, and then there are no lesions, inflammation, or deformities. And then I'm just going to palpate your maxillary, or your frontal, and then maxillary sinuses. Any tenderness?
No.
Palpate down the bridge of your nose. Any tenderness here?
No.
Okay, and then I'm going to have you occlude one nostril and breathe in, and then the other. Okay, so the nares are patent. Looking at your lips, they are pink and moist, which are consistent with ethnicity, and then there is no cracking or lesions. And then I am going to take a look in your mouth. So just say ah. Okay, and then the pharynx is pink with no edema or exudate. The tonsils are pink with a grade of 2, and then the uvula is midline and it rises with phonation. And then I want you to stick your tongue out and then put it to the roof of your mouth. Okay, and then I'm just gonna have you smile now. Okay, and so then the buccal mucosa, the floor of the mouth, and the tongue are all pink. There's no growths, lesions, or inflammation, and the tongue is midline and even. And then the teeth that we saw, the teeth are white, straight, evenly spaced. There's no dental caries, and the gums are pink, and the teeth adhere to the gums without any bleeding or discoloration. Then we're gonna look at your eyes and your ears now. Okay, so we tested your distant visual acuity using the Snellen test in practice, and that was 2020 with corrective lenses. And then we used the Rosenbaum test to test near visual acuity, and that was 2020 for both eyes with corrective lenses, and those both test cranial nerve 2. And then I'm going to test your 6 cardinal fields of gaze, which tests cranial nerves 3, 4, and 6. So just follow the tip of my pen. Okay, and there's no nystagmus noted. And then I'm just going to now do inspect your eyes. So I see that can you pull down here? Okay, thank you. And your conjunctiva is pink, the iris is blue, the sclera is white, the cornea is clear, bright, and smooth. The upper and lower lids are intact with no redness or edema, and then the eyelashes are evenly distributed and they curve outwards, and the eyebrows are symmetrical and they have even hair distribution. And then I'm going to palpate. So I'm going to palpate the lacrimal apparatus, the lower lid, the upper lid, the eyebrows, and then the bone orbit here. Any tenderness?
No.
Okay. And then I'm going to do perla. So I'm just going to look straight out at me. Your pupils are about 9 millimeters in diameter, and then they're equal, they're round, and then I'm going to shine a light in them. Okay. They're reactive to light, and then follow the tip of my pen away and back in. Okay. So, and then they accommodate, so perla is intact, and that tests cranial nerve 3. And then I'm going to look at your ears. Can you pull your hair back a little bit? Okay. The tops of the ears are in line with the eyes. They're symmetrical. There are 1 lesion each on the ear. And then they're pink, which is consistent with ethnicity. And then I'm going to look in the ear canal. And there's no cerumen noted. And then I am going to test your hearing, which is going to test cranial nerve 8. So I'm going to come behind you and then I'm going to rub my fingers together and you're going to tell me which side.
The right side. And the left side.
Okay. So cranial nerve 8 is intact. And then we're going to move on to the skin assessment. So looking at your skin, I see that your skin is pink, which is consistent with ethnicity. It's clean, dry, and intact. And then I'm just going to palpate along using the back of my hand. And then your legs as well. Okay, your skin is warm, smooth, and firm. And then I'm going to check for and then I am going to look at a lesion. So let me look at your arm here. I'm going to use this one here. It is symmetrical. It has even borders. It's brown in color. Its diameter, using this ruler, is 1 millimeter. And then it's not elevated, there's no exudate, and then has it changed over time?
No.
Okay, put my ruler back. And then I'm going to look at your hair. So I see that it's brown, it's thick, it's evenly distributed, it's a little wavy. And then I'm going to check behind your ears and your neck. Okay, there are no parasites present. And then I am going to look at your fingers and toes. So your nails are painted, so I'm just going to do capillary refill on the side of the nail there and on the bottom here. Okay, so capillary refill comes back in less than 2 seconds. The nails are curved, pink, and smooth. There's no clubbing that I see. Can you also do this with your fingers? There's no clubbing. And then I'm going to look at your neck. And I see that it is symmetrical and there's no masses or scars that are present. Okay, and then I'm going to start with the assessment of the neck vessels and the heart. So looking, I see that your carotid arteries are symmetrical and they are not bulging or distended in any way. I'm going to first auscultate on each side, so I'll have you turn your head and hold your breath. And then I'm going to auscultate in 3 places using the bell of my stethoscope. Okay, and then to the other side. Okay, hold your breath. Okay, and there's no bruising noted. And then I'm just going to palpate for your pulse. And the other side. Okay, so the carotid artery pulse is +2 and smooth bilaterally. And then I'm going to palpate across your chest using 3 fingers. The precordium. Was that tender at all?
No.
Okay, and then so there, I feel no masses, nodules, or pulsations. And then I'm going to listen to your heart using first the bell of my stethoscope and then the diaphragm of my stethoscope. So I'd use light pressure with the bell and firm pressure with the diaphragm, and the 5 parts. So I'm going to start with the aortic and the second intercostal space on the right sternal border, the pulmonic on the left sternal border, second intercostal space, Erb's point, the third intercostal space of the left sternal border, the tricuspid, which is the 4th intercostal space of the left sternal border, and then the mitral, which is the 5th intercostal space on the midclavicular line. Then I'm going to go through and listen with the diaphragm of my stethoscope to the aortic, which is the 2nd intercostal space on the right sternal border, the pulmonic, which is the 2nd intercostal space on the left sternal border, the Erb's point, which is third intercostal space on the left sternal border, the tricuspid, which is the fourth intercostal space on the left sternal border, and then to the mitral on the fifth intercostal space of the midclavicular line. Okay. There's no aortic bruit. S1 is louder than S2 at the apex, and S2 is louder than S1 at the base. Heart rate was regular, or heart was regular in rhythm and rate. And then there were no extra heart sounds or murmurs. And then I'm going to listen in the mitral area for the apical pulse for a full minute. So I'm going to come over to this side to assess rate and rhythm. My watch here. Okay. Okay. Heart was regular in rate and rhythm, being at 68 beats per minute. I'm going to move on to the thorax and lungs. So I would look at the rise and fall of your chest for 30 seconds and multiply by 2 to get the rate. And I see that your breathing is even and unlabored. And then I'm going to ask you a couple questions about orientation. So, can you tell me your name?
Audrey Pulley.
Can you tell me where you are?
My apartment.
Can you tell me why you're here?
This video.
Can you tell me what day it is?
Monday.
Okay. And then I see that there's no cyanosis present on the lips or the tip of the nose. And then her condition is relaxation, and then her facial expressions are relaxed. And now I am going to palpate across the chest wall using 3 fingers. And I feel no masses. Isn't any that tender?
Mm.
Okay. And then I'm also just going to look at the front and then the side of her. And then the AP to transverse diameter is 1 to 2. The thorax is symmetric and elliptical. And my patient is sitting upright. There's no tripoding present. And then I'm going to find her xiphoid process. And I find that the costal angle is less than 90 degrees. And then I'm going to have you, so I can see your back here. And then I'll have you take a deep breath. Okay. And then, so the chest wall is stable. And then I'm going to listen to her respirations using the diaphragm of my stethoscope. 6 places on her back. And then I want you to take a deep breath every time that my stethoscope touches your back. Okay, and then lungs are clear in all lobes bilaterally, and then I'll have you turn so that you can see your chest. Okay. I'm going to do the same thing on the front. So take a deep breath every time I stethoscope pitch your chest. Lung sounds are clear in all lobes bilaterally. And then this patient had no adventitious breath sounds, but if they did crackles, would sound like high-pitched popping sounds, and wheezes would sound like high-pitched musical squeaking sounds. Then we're going to do the peripheral vascular assessment. So I'm going to take a look at your arms, and I see that they are pink, which is consistent with ethnicity. I'm going to squeeze down them. They are warm. There's no edema present. And then do this again. I'm going to check for clubbing. Okay, there's no clubbing present. And then I'm going to do capillary refill on your fingers. Okay, comes back in less than 2 seconds. And I'll just have you flip your arms over like before, and I'm going to check for your radial pulse. Radial pulse is +2 and smooth bilaterally, and then brachial. Is +2 and smooth bilaterally. And then we'll take a look at your legs. And legs are symmetrical. There's no hair because the patient has shaved recently. And then I see no presence of, there is a little bit of discoloration due to a bruise. There's no ulcerations or varicosities. And then I'm just going to feel. The legs are warm, and there's no edema present in the legs. And then if I were to feel for a femoral pulse, that would be in the inner line of the groin, and that would be +2 and smooth bilaterally, regularly. And then can I have you flip over to see the back of your knees? Okay. I am going to feel for your popliteal pulse. Okay, I feel it's +2 and smooth bilaterally, popliteal pulse. And then I am going to feel for the posterior tibial pulse behind the ankles. +2 and smooth bilaterally, and then I'll feel for the pedal pulse, which is +2 and smooth bilaterally. And then I am going to move on to the abdominal assessment. Patient's stomach is pink, which is consistent with ethnicity. It's symmetrical, and it's flat, and the skin tone is even throughout. And can I have you bear down, please? Okay, there's no herniation, and I see no pulsations. And now I'm going to listen to bowel sounds, starting in the right lower quadrant using the diaphragm of my stethoscope. Okay, and then using the bell of my stethoscope and light pressure, I'm going to listen for an aortic bruit. Okay, so bowel sounds are normal active. I hear no aortic bruit. And then I am going to palpate using 2 fingers. Circular motions. I'm gonna actually have you bend your knees, actually. I'm gonna do that again. Okay, was there any tenderness with that? I want to do a deep palpation because then I could end up harming my patient because that's an advanced provider skill. And I'll have you sit on the edge here so I can see your back. Okay. I'm going to use the ulnar side of my hand. I'm assessing for CBA tenderness. Any tenderness with that? Okay. Other side. Any tenderness with that?
No.
Okay. Then we'll move on to the musculoskeletal assessment. Have you had any surgical history?
No.
Okay. So I'm going to be looking at your shoulders and your hips. Okay. So just inspecting your shoulders. I see that they are symmetrical and I see no swelling or deformities. And I am just going to palpate them. Is there any tenderness?
No.
I feel no increased temperature, masses, or nodules. And then you just move your arms. Okay, and I feel for no crepitus. And then we're going to do active range of motion exercises. So I'll have you do flexion, just put your arms out straight. And then extension, hyperextension back. And then abduction and adduction. Okay, and then circumduction. Okay. And then against resistance, I'll have you shrug your shoulders. Do flexion. Okay, and then abduction. Okay. That'd be +5 bilaterally. And then I'll have it look at your hips. So if you can move back. Okay, and then I see no, they look symmetrical. I see no swelling or deformities. I don't feel any masses or nodules. Is this tender?
No.
Okay, and then kind of just move your hips, or move your legs to your hips. Okay, and I feel no crepitus. And then we'll do range of motion exercises, so you might want to scoot back a little bit. Okay. And so first we're just going to do abduction, so move your legs out, and then adduction, and then inward rotation of each leg. So bend your knee and over, bend your knee and over, and then outward rotation, bend your knee and out, bend your knee and out, okay, and then extend them out, okay, and then circumduct them. Okay, you can do it one at a time. Okay, and then against resistance, I'll have you bring your shins up, okay, and then I'll have you do abduction, okay, and then I'll make sure that you are in a comfortable position. I would do hand hygiene again, and then I would go document.